weight loss surgery in France at a specialist hospital in northern France.
The video you're about to see in Le Havre and all the hospital facilities for bariatric surgery is all organised by Laser Clinic in France. From the moment you are collected in Paris by the limousine taxi services to the moment you are taken back to Paris for your return journey back to the UK, Laser Clinic in France has organised everything for your bariatric surgery and are contactable 24/7.
Hello everyone, my name is Tulle Law of Laser Clinic in France, and I'm the person, should you choose of course, to phone me, and at the end of this program you'll have all our contact details, because I'm the person that you'll be dealing with concerning everything concerning your weight loss surgery that you may be requiring. First of all, I'd like to tell you about the hospital. The hospital is the largest French NHS hospital in France. Over 2,000 beds, all in private rooms with their own bathroom. And if you bring anybody with you, they can be in that same room with you for 1 or 2 nights, depending the operation you have. That's how long you are in the hospital. So you needn't be on your own. You've got a very, very good bariatric surgeon and his team looking after you. And all the nurses and everybody speaks English. The hotel, you're in the hotel for 2 persons, for you and whoever accompanies you, bed and breakfast. Again, no extra charge. When our taxi service picks you up, either at Paris airport or maybe Eurostar terminal in Paris, they bring you to this hotel and everything, in other words, is provided for you. It's a full package. You have nothing to worry about at all. All you have to do is get to Paris and leave the rest to us. All I can say is please take the opportunity of looking at this video and doing something that you're probably wanting to do for a very long time, and that is to take a positive view of any weight loss issues that you've got, and now you've got the opportunity to have something done at affordable prices. We look after you from the moment you arrive to the moment you leave us. You've got absolutely nothing to worry about, because the bariatric surgeon and the hospital are second to none for the aftercare that they give to all the patients, irrespective whether you're from the UK or anywhere else. It is part of the team that works with the head bariatric surgeon and gives you the best care that you can have.
Hello, I'm Dr. B, the Chief of Surgery in the hospital group of Le Havre, which is the most important communary hospital community hospital in France. I do all kind of surgery. I have begun with the band, and after I moved to sleeve and bypass, and actually I do mainly bypass. Okay, this is the result of all my patient operated on from 1998. This is all the patient operated on. The average at the beginning is 125 kilo, and after 6 years is 93 kilo. The bending is to put a band around the upper part of the stomach, and there is a pouch, and this pouch dilate when you eat, and you feel my stomach is full, so you stop to eat. This is the stomach with my name on, and this is the stomach and the beginning of the small bowel. If I do a sleeve, I remove 4-5 of the stomach, and I left a tube. Okay, it's not because I remove part of the stomach then the patient lose weight. It's because I remove the part of the stomach secreting a small hormone. The name is ghrelin, and this hormone stimulates the appetite. So if you remove this hormone, the patient doesn't want to eat, do not want to eat, so it's easy to lose weight. At the beginning, the patient, the weight is much important. It's more important because the sleeve is a good operation for the very, very big patient. And you can see after 6 years, the weight is around 90 kilos. So for me, I do mainly actually bypass. So you cut the stomach like this, and you have a pouch and the remnant. You do not remove any part of the stomach. So if you come back, it's possible after the surgery. After, you take the small bowel 200 centimeters, 2 meters after the beginning of the small bowel, and you do an anastomosis with the pouch. So you cannot absorb lipid and protein in these 2 meters, so there is malabsorption, and you lose weight because you have this malabsorption, and because the end of the small bowel is secreting a small hormone, the PYY, which inhibit the appetite. So it's very easy to lose weight. And for me, after 5 years, the better result is with the bypass. The average before the operation is 123. After the operation, the weight 5 years to 6 years after the operation, the weight is only 73 kilos. To avoid any insufficiency after bypass and also sleeve, the patient have to take every day a pill or powder of multivitamin cocktail, and every 6 months during minimum 5 years he need to have a checkup to see how is the iron, the vitamin A, B1, B6, B12, D, and he needs some treatment if there is a decrease.
It's not call now for free, no obligation initial consultation. Call 0033 68 65 67031 now. We are waiting for your call, and thank you.